Hoje eu estou aqui super emocionada, feliz e agradecida a Deus pelo privilégio, pela honra de poder entrevistar o doutor mais querido aqui de Orlando, o doutor mais procurado por americanos, por brasileiros, por todas as mulheres aqui na Flórida, o doutor James Mullins, aqui me visitando na VFB Insurance, e a gente tem muitas perguntas para ele, ele vai responder. Dr. Mullins, thank you so much to be here with me today. Thank you for taking your time, your precious time, to come over here and help other women understand the importance of have a best doctor, I would say, take care of them, their health. Dr. Mullins, tell me a little bit about you.
Sure. I appreciate you having me. Thank you. I would love to give you my background. I am an OBGYN doctor. I trained up in Michigan. I actually graduated in 2000 from residency and started private practice in the Michigan area, in the Detroit area. And so when I was there, it was very busy, and typically our practice was very busy. We did a lot of deliveries, a lot of surgeries, and in about 2000 is when I started training to do more specialty type surgeries. The robotic surgeries that I do now, I started back in 2010. And about 2015, 2016, my wife said to me that she doesn't want to retire in Michigan, and so she really was interested in making a move, and so we spent a great deal of time thinking about and praying about, and we decided to make the move. And the practice that I'm currently at here, they offered me a wonderful place and great doctors and providers that I'm working with, and so the OBGYN of Central Florida is where I'm at right now. I've been here for about 3 years, so we started in 2020, and it is incredibly busy. I am very fortunate. Yeah, it's good job security. But yeah, the volume of patients that we have seen and
I know.
It is awesome, and being able to help.
Como eu falei aqui, ele é muito procurado por todas as mulheres, muito querido, porque ele tem uma empatia com as pessoas. E Dr. Mullins, I heard you say that you decided 4 years ago to move to Florida.
Yeah.
And what I saying that we always praying for good doctors come over here to help my clients. I been asked because it's a lot of doctors over here. They are full, complete booked. But we miss the connection. We miss the care. We miss the compassion. The doctor take the time to look at the patient in the eyes and see their needs.
Sure.
And that's what I heard about you from all my clients that go visit your office. They all say, "Oh my gosh, Veronica, thank you so much. He is amazing. He changed my life. He is the best." That's why I have to invite you over here and tell me how you feel this connection with your patients.
Well, it's what I've always said is it's important to hear their side, and when a patient comes, yes, we have a certain set of questions that we want to ask them, but it really comes down to their own words, how this is really affecting their lives, what conditions they're having, whether it's, if it is a baby, it's what conditions with pregnancy, obviously, but if
How
it's
many babies you say you delivered?
I don't have exact numbers, but I would say in the range of 5,000-6,000, I would think, yeah. So,
pressure.
Yeah, so there's a lot,
precious.
there's a lot. It's really, I want to hear what is really bothering them, what is really their concerns, because, if we hear one thing when we're taking an interview with the patient, but when they say, the only thing that's really bothering me is just the cramping or just the bleeding, and the bleeding is just so bad that it's causing this in my life. That's what I want to hear, and that's what I want to treat, and that's what we.
That's why I recommend Dr. Mullins for my patient. When they call me and they tell me I need to do my annual, and I need to do my checkup. I have this problem. I have a bleeding problem. I can't have, my life is not, I can't act normal when my period come. I have so many cramps. I have a heavy bleeding. I don't know what to do. I've been this doctor. Nobody tell me what to do. So I tell, I have a doctor for you. Dr. Mullins, because he listens what you need. And another thing that I notice in a lot of women, they are afraid sometimes to talk about the how they feel, what's caused. Why most women have this period in their life, they start bleeding so much?
Well, there's any number of reasons why women start bleeding, but unfortunately, the number one thing they have to understand is it's normal. It happens a lot. It happens to a lot of women. They're not abnormal because of it, and we just have to figure out the course, or what is the source of her bleeding. And so we focus in on that. We focus in on doing a thorough workup, in whether it's blood work, ultrasounds, images, biopsies. We do everything necessary to try to figure out what it is so that I can say clearly, this is what I think it is. And then we give them a whole bunch of options. I say at the end of the day, as much as I love doing surgery, I don't want surgery done to me.
Yeah.
And so, it's easy for someone sitting in a chair to look at you and say, I'll just get surgery done. But at the same time, surgery is probably the best option. And so that's where I try to give them.
That was my next question.
Yeah.
When it's the treatment stopped to work and when they have to do the surgery. I'll tell you why I'm going to ask this question. I have an assistant. She was crying here for at least for 3 months because the doctor told her that she needed to do the surgery. And she was like, what's the name of the surgery?
The robotic hysterectomy. Mm-hmm.
Yeah, she was crying. She thought, I'm going to die, or I don't know, what if I want to have a baby later? Because her life was totally messed up with bleeding, or heavy bleeding, cramps. But Dr. Mullins, after treat her for at least 1 year, they decided to have a surgery. Her life now, I want to bring her to give a testimony too. But her life now is completely different. She lost weight. She's happy. She is like, oh my gosh, my life changed after the surgery. And she showed me the surgery. It was a little dot like that on her hand. I said, what? I'm used to see big cuts in woman's belly to remove the uterus. I see like they're not happy.
Yeah.
Woman is not happy with that. So Dr. Mullins have this amazing surgery they call robotic surgery.
Just robotic surgery,
Explain me a little bit more about it.
Sure. So, when we're trained, depending on when we were trained during our residency, I was trained in an era where we did mainly open or vaginal type surgeries. And so then laparoscopic stuff started coming into play, which is laparoscopic surgery is basically outpatient surgery. What it is you make small incisions, you insufflate the belly, and of course you're under total anesthesia. You're not feeling a thing. You're not feeling a thing. And we inflate the belly, and we put tubes within the belly. Well, the instrumentation was the limitation of the laparoscopic surgery. And what I mean is that the instruments were straight, and so they would do a lot of this. They would just move in and out. You might be able to articulate them a little bit. And you also stood and looked at a screen that had basically a two-dimensional view. So you're looking at a screen, which is still a good screen, but you're looking inside and you're doing this. So a lot of limitations with regards to if there's a lot of adhesions, if there's a lot of endometriosis, if there's a lot of big fibroids, big masses, you just couldn't attack those because you couldn't get around it, you couldn't move. So the Intuitive basically started training a lot of the GYN surgeons back in about 2005, 2006, and they started training us to do it robotically. And I believe 2010 was when I picked that up, where I started doing, because I was doing a lot of laparoscopic and then I went to robotic. And it was night and day. And the difference is, it's, again, when people hear robotic, they think that it's the robot operating itself, and it has nothing to do with it. No, it doesn't, nothing to do with it. It's basically, the robot is just a function of what you're able to do in connection to the instruments. So basically, when we connect the robot to those same ports, the instruments slide in and they connect to the robot arms. Well, the robot arms are hardwired over to what we call a console. So as I get the patient docked and get the robot docked and the scope inside them, and by the way, the scope on the robot has 2 lenses. So I actually see 3-dimensional.
It's perfect.
So when I'm
The
looking
vision is
versus
perfect.
it's perfect compared to looking at a screen. When I go, after I get everything set, I go and sit down at a console. Then I look through a viewfinder and I sit down. I actually take my shoes off and I sit down and I actually put my fingers in these Velcro strips, and anything my wrists and fingers do, I can do inside. So it's very meticulous, it's very
Wow.
precise. And so it's afforded me the ability to learn how to do more complex things. So even if I walk into a case where I don't know it's going to be complex, and it is, I can still handle it. So it's that's what I love. And then
Amazing.
the advances in just recovery is that's
Wow.
what I love. I love being able to send patients home the same day.
Oh, wow.
You know, we talk about ovaries because not necessarily part of hysterectomy. So we talk about leaving them. So they
still
have their
can
own
have
hormones.
the
They have their
hormones
own
are
hormones.
function normal.
So totally normal, and you know, I take care of their problems. And so it's yeah, I've done probably well over 1,000 robotic cases now, and yeah, to see the recovery and to see them coming back in at the 2 weeks and 8 weeks marks that I have them as a post-op visit, they love it. And
The
you know,
perfect combination of the amazing doctor and the technology
Yes.
together to help women to be healthy. And that was one of my clients was very worried about that when they have the hysterectomy,
Yep.
they will not have the ovaries, they will have the change, they
Yep.
have to do hormones,
Yep.
treatments, all this stuff.
Yep.
And then after a surgery and the recovery was like amazing. I think it was, she went back like in 2 or 3 weeks.
So yeah, the recovery is what's incredible.
It's
You know,
incredible,
it
right?
is. You know, some women do require a little bit more, just mainly because they're still tired, they're still run down from the surgery. So some women do require a little bit more, a couple more weeks, but usually after about 2 weeks, what I quote patients is usually by 2 weeks, patients are somewhere between 70 to 90% recovered.
Wow.
Which means that that's just, you can do things, and especially moms that have children that need to function at home and do stuff, you can still at least get up and do stuff.
Exactly.
But if they want an excuse for not doing dishes and cooking for a month or 2, I'll give it to them, and you know, husband has to step up.
He's sweet. He has 6 kids. He's an adorable wife, so he understands exactly how women function.
Well, I give credit to my wife because I couldn't do what I do unless she did what she did at home for me. So that's
Perfect combination. So Dr. Mullins is very, very sweet. He's have a heart while he do it. I can tell. Just talk to him. What I hear from my clients, they're just like amazing. If you need, if you have any concern about your health, if you have any having bleeding, I know you was telling me about.
sure. Some conditions.
Some conditions. The most common.
Sure.
Yeah.
So you know, again, most of the time it's pain. It's, you know, maybe they already know they have a history of endometriosis. They have fibroids. Just a lot of irregular bleeding. Those are the big conditions that I deal with a lot, and those are the ones that obviously usually affect life the most. And you know, sometimes it's just cyclic, where it's just happening during the cycle time, or sometimes it's happening all the time, on and off. And so, you know, it comes down to the urgency of what I need to do and how quickly we need to do things as well. So, you know, I take that into consideration as well, because, you know, sometimes it's just heavier bleeding and it's just an annoyance and we're trying to figure out how to medically treat it, versus sometimes they're saying, okay, this is, you know, this is hard, too hard on my life. Yeah.
Yeah, I heard a lot of cases of my my clients. The life change after surgery. They get scared to do, because if they could, like you say, nobody want to be in tape to have a surgery, but sometimes it's necessary. The only thing that I recommend, always go to a doctor that you feel confident, that you feel that he have knowledge, they have the technology, they understand how to use properly. It is your life. So this is a very, very important decision, So that's why it's so important to have the doctor that you trust, that you know what you do, because change, it's a very important moment, right?
Yeah.
So,
Absolutely.
Dr. Mullins, what else you want to advise my clients? What do you would like to
Well,
tell for a woman to have a better life?
Well, again, regular checkups are critical.
That's what I say.
Things are definitely a little different when it comes to some of the training expectations from Brazilian physicians to American physicians, and so there is some differences. And so obviously that you have to understand that there's always going to be certain things, but as long as your doctor's explaining why they do it differently than what they did in Brazil,
Exactly.
that's the most important thing, is educating the patients and stuff with that. Regular checkups, I mean, from pap smears to mammograms to needing routine ultrasounds, those are critical, obviously, in finding things. And I can't tell you how many times you can find a problem that we have to treat. The goal in medicine is to treat things before it becomes serious, right?
Prevention.
Yes, exactly. So
Just like what I
prevention
say,
is,
prevention is the solution. I always
Yeah.
tell my clients,
Yeah.
don't let you do your checkup annual. Make sure they call your doctor. Make sure
Yeah.
that you do all exams, blood
Yeah.
work, ultrasound, everything. If you find out whatever is wrong with your body in the beginning, everything that is possible to treat. So just talking about a little bit things that happen these days is a lot. It's a cancer,
Yeah.
like the prevention. Like the pap smear is one of the
Sure,
preventions.
sure. So, pap smears and criteria for that, we use a lot of what American Society of Colposcopy and Cervical Pathology group has set. It's a specialty group that looked at all of the information about pap smears. And so pap smears, even the design of pap smears, don't mean that we have to automatically do them year by year now. So we can actually do pap smears with HPV testing. So I explain that to people, because even between 30 to 65, if you have a pap with HPV, you can actually space those out. But I always say you still want to come once a year, because even if I'm not doing a pepanicola, I still want to look at that cervix. I still want to do a pelvic exam. I still want to see if I feel a mass. I have found fibroids. I have found ovarian masses that we didn't know. Again, a lot of them are benign. A lot of them doesn't mean it's going to be cancerous, but still it's a very scary thing in a woman's
is.
life when you find something on an exam. And so you walk through all that. You just but the key is, like you said, coming in, getting the visits, the routine visits and stuff like that, so that you're comfortable. And being comfortable with your doctor, I think, is key. I really, unfortunately, there are a lot of good doctors out there. There really are a lot of good OB-GYNs that are out
I'd
there.
say it's not,
Well,
we have to search a
right,
little bit. I do the
right.
search for my clients, so to
Right,
get the best
right.
ones.
Well, the problem is I don't see the bedside manners, right?
Yeah.
I don't know how they are when a patient's in the room and how they're walking
Exactly.
into the room. So I don't know. So surgically wise or delivery wise, I might think that they're a great doctor.
Exactly.
But I don't know.
How is-
So that's word of mouth, right?
Yeah.
And that's the key is having someone like you that can guide people to a group of doctors that you really do admire or like. And it's not just because of hearing about it, but it's because you've actually had testimonials.
Testimonials,
about it.
yes.
Yeah.
It's very important for me. Make sure that my clients have the best treatment, the right treatment.
Sure.
So it's very important for me know the doctors here, because, like I say, it's a lot of good doctors, but you need to find them. So I find Dr.
Yeah.
Mullins, and I'm very happy. And there are another few doctors that I know, and I completely trust them to refer them to my clients. And that it's very, very, very important to have the doctor have a compassion. They have time to explain.
Sure.
Like Dr. Mullins explained to my clients, oh, we're going to do this because this is better for you. Or let's keep looking for a solution until you feel comfortable. And this is very important. So we're talking about a lot of health for women, how women can keep health. Prevention is the solution.
Sure.
Like
Sure.
I always tell
Absolutely.
my clients, prevention is the solution. The annual doctor follow-ups, doctor's appointments.
Absolutely.
Let's talk about the pregnancy.
Sure.
How is for most women? It's a beautiful moment. It's amazing. You're gonna bring a new life to this world. It's just amazing. Be a mother. I have 4 kids, and I love it. So I know, but also it can be a little bit uncomfortable too, right?
Just a little bit.
Still a little bit. If you're the first, you worry about how it's gonna be, and if you're fourth, you go, oh my gosh, what's the difference now?
Well, the hard thing is that, you know, especially first, is, you know, you're basically gaining most of your information from family and friends, right? And so I always joke around with women and say that, you know, after this first pregnancy, you too will be an expert at pregnancies. And you will give advice, and hopefully it's good advice, you know, because there's a lot of bad advice out there. And there's a lot of things that other people get concerned about that is not a concern. And so there's a lot of reassurance, you know, when things are going on, is telling them that, you know, that the pregnancy is proceeding as we should, and everything is going well, and the baby's growing, and appropriately everything is going well. And that sometimes is all they need to hear, you know, but again, they get bombarded by a lot of people that have negative comments and stuff. I had one time, I had a patient I'll never forget. She had a little bit of spotting, and she came into my office, and it was her first trimester. And so, you know, we did an ultrasound. We showed everything was fine. And basically, she said, thank you. She said, but, you know, I was at work yesterday, and the reason I came in so quickly was because a coworker who never talks to me all of a sudden found out I was pregnant and heard I was spotting, and she said, well, you better get to the doctor because my cousin had a miscarriage and it sounded just like this.
Oh, wow.
Why would you say that? One, why would you say that to someone? Just to scare them. There's so much out there, and to be reassured from your doctor, I think, is a lot.
That's a lot, you know. And feel trust and know and trust that he knows the best for you. He knows the best treatment. He knows and some doctors care too. Sometimes they, or you need to do this check because your baby, especially if you're after 30 or 40s, in the 40s, your baby can be have a problem, this and this and that. And I had my baby. I was 39, my last baby, and oh my gosh, I was so scared. It was all, oh, really? And then, so.
I know. The whole advanced maternal age, I totally understand that personally. So,
sometimes we need to have a little bit hard to talk to the mother.
Yes,
That's how you say things.
How you do, It's all about bedside manner a lot of times.
Exactly.
So,
Dr. Mullins, I really, really appreciate your time. So you come over here and explain everything for my clients, and the best treatments, and the importance of the prevention, and the new technology for surgeries. I am very, very honored to have you here.
I greatly appreciate it. Thank you so much.
I really appreciate it.
Thank you. I appreciate it.